Hello, everyone. Today I'll be talking about breastfeeding support and particularly about blocked milk ducts, engorgement, and mastitis. My name is Katrina Wong. I'm a pelvic floor and orthopedic physical therapist, and I help postpartum moms recover from any pelvic floor conditions as well as providing breastfeeding support. So, did you know that 60% of breastfeeding women experience clogged milk ducts? It's really common, and a lot of people, when they initially start breastfeeding, they think it's going to be a lot easier than they think. Because you don't really get a lot of training on it or a lot of education on it during your pregnancy period. But this is really common. And as a physical therapist, I see a lot of women with engorgement, mastitis, and clogged milk ducts. And I'm able to provide them some physical therapy treatment to help improve milk flow and decrease pain and discomfort. So, typically, the problem with engorgement, mastitis, and clogged milk ducts is that there's an oversupply issue. So many women are told to try and pump or breastfeed more to make sure that their breasts are empty to prevent mastitis, engorgement, and blocked milk ducts. However, the more you actually try to pump or breastfeed, the body thinks you actually need more milk than what you're originally producing. So your body's going to make more milk, and it actually can lead to more issues, more swelling, more clogs, um, more inflammation in the breast. So we'll kind of dive into each of the three common conditions I see. So the first we'll talk about is mastitis. So mastitis is a painful inflammation of the breast tissue and commonly associated with swelling, redness, warmth to touch, and fever and chills. Sometimes you may not have the fever and chills, but typically you'll have kind of like the swelling and the warmth to touch. And oftentimes, mastitis is just inflammation, not really an infection. So, most of the time, when you think you have mastitis, you go to your doctor, they immediately prescribe you on antibiotics. However, just because you have mastitis doesn't mean you have an infection. So, it's important to understand that mastitis does not equal an infection, it could just be just inflammation alone. Causes of mastitis. So many women are told that it's due to very inconsistent feeding. So let's say you skip a feeding in the morning or you skip it during the nighttime, or if you're not emptying your breast all the way. And a lot of women are told to prevent mastitis, they should try and pump and breastfeed more, or just, make sure there's no milk at all in the breast to make sure there's no milk remaining that could possibly contribute to mastitis. However, the more and more you tend to breastfeed and pump, again, it just tells your body, I need to produce more milk because my baby needs more milk. When it's actually you just, manually expressing or trying to pump more. So it's really important that when you think you're about to have mastitis, instead of trying to empty more or pump more, try to leave it alone. Something that can help is trying to empty or like if you're in a lot of discomfort, trying to empty the breast like 1 or 2 ounces of milk just to kind of relieve any pressure or discomfort, but not to fully empty it. So let's say you have mastitis on your left breast and the right one is fine. So I typically tell patients when they try and feed or breastfeed to feed on the affected side first. So you want to feed on the left side and just feed 1 to 2 ounces to kind of like top off and kind of relieve any pressure or discomfort, and then feed the remaining on the right side, which is the non affected breast. So that's something I typically recommend because, again, with mastitis, you don't want to try and pump more, breastfeed more on the affected breast because all you're doing is stimulating the body to make more milk, making the problem even worse. Engorgement we'll briefly talk about, but it's very common if you also have mastitis and clogs, and typically peaks on day 3 to day 5 of postpartum because your body starts to, really ramp up its milk production. It's starting to figure out, how much milk do I really need? And typically you have a lot of swelling in your breast. The typical treatment for engorgement is doing a lot of lymphatic drainage, gentle massage techniques, just to kind of improve circulation and improve milk flow in the breast. Block milk ducts is what we'll spend most of our time on. And they're typically very uncomfortable, painful, and you might feel a hard lump in the breast, and that could be backed up milk that's not able to drain very well. With typically blocked milk ducts, again, they're typically due to a hyperlactation or oversupply. So, women who are trying to pump more or feed more, empty their breasts, again, the body's producing way too much milk. So, there's milk that's kind of accumulating in the breast. So at Whole Body Wellness and Physical Therapy, I'm the physical therapist here that really provides support for breastfeeding moms. So we provide very gentle therapeutic breast massage, lymphatic drainage, and therapeutic ultrasound to relieve any clogs and pain that you have. So if you have any questions, please feel free to put them in the comments, and you can contact me. At my Instagram or my email or my website if you are interested in relieving any pain or discomfort that you have. Something that you should know is if you are having a clog, to not over massage it. So typically, if you have a hard milk spot, the internet or Google tells you to really work on it or massage it, use a vibrator. But actually, you don't want to be too aggressive with it because you don't want to irritate the tissue. If you're doing really aggressive massage and you're really trying to drain it, I mean, the only thing that you're really doing is your body is saying, I'm going to produce more milk. So you want to make sure that the massage is actually very gentle. So typically during the sessions, we do very gentle massage techniques to improve circulation, to improve milk flow, and just to drain and just open things up a little bit, and then hoping that it'll kind of create more openness in the ducts and just the milk flow in general. So again, if you have any questions, please feel free to reach out, and we can talk about if physical therapy is appropriate for you.